The implants themselves come in a variety of different shapes, sizes and consistencies. And really it's the job of the surgeon along with the client to try and figure out what one of these implants is actually best for them. If somebody wanted a bigger cleavage, we may consider a round implant. If somebody wanted more of a natural shape, we may consider an anatomical or teardrop shape implant where more of the volume is actually on the lower part of the breast. And we then have different sizes, so if you wanted to have a bit more projection, we can go for a higher projection implant. If you wanted to look a little bit more natural, we can go for a lower size implant. And so really the part of the consultation process is really to help define what implants are best for that specific person, and it's all very bespoke. So the first part of the journey is to make sure that you're actually suitable for a breast augmentation procedure. Following on from there, you will have a holistic assessment, and that is just to make sure that all the other elements of support is actually there to make sure that you're safe to undergo the procedure. And then on the day of the procedure, you come in a couple of hours before where you meet the anaesthetist, and then you'll meet the surgeon and you'll have the markings done pre-operatively. The procedure itself lasts between an hour to an hour and a half. It's under general anaesthetic. Some people go home the same day, but a lot of people end up staying one night so we can monitor the breasts and make sure that adequate pain relief is also administered overnight. But approximately a week later, you'll get seen by the cosmetic nurse to make sure that all the wounds are healing up well. And then throughout the next 3 months, you will meet the surgeon again to make sure that the recovery and the implants and the breast itself is settling down the way it should do. So immediately after surgery, it's quite normal to experience pain, but there are lots of pain medications that you can take. And you'd expect to be in a reasonable amount of discomfort for approximately 4 to 7 days afterwards. So during the first week, it's important you look after yourself. So no heavy lifting, nothing strenuous such as going to the gym. You can have a shower after a few days. You can go for short walks, but really nothing more than that. After the first week, you'll probably start to feel a bit more your usual self, and you may want to consider driving at that point, and you need to make sure that you wear your post-operative bra for 6 weeks afterwards, and certainly no gym or anything else for 6 weeks afterwards either. In order to insert the implant into the breast, you have to make a small scar, and routinely this is just made in the crease under your breast. So that scar is about 4 centimeters in length, and it takes about 2 weeks for that to fully recover. The scar then takes about 3 to 6 months to then fade into a fine silvery line, at which point it's fully healed. So early risks are pain, which we've already discussed, bleeding, and in about 1 in 100 patients you may have to return to theatre to stop the bleeding. Infection, so in about 1 in every 1,200 patients can get a severe infection which requires removal of the implant, antibiotics, and you may have to wait a period of months before having a new implant put back in. One of the really important things to remember about breast augmentation is that your body creates a covering around that implant known as a capsule, and that capsule will get firmer over time. And as that happens, the breast implant will change shape, and it can distort the shape of the breast, and it can become painful. So approximately 10 to 15 years after you have your breast implants, it's quite normal to go along and have a revisional procedure where you may have to replace the implant or think about having them removed altogether. We adhere to all the regulations that are there, whether it's CQC, whether it's the regulations that have been put forward by the British Association of Plastic Surgeons. We have a cosmetic nurse as well who will make sure that they're your first point of contact throughout this entire journey. So you know you're in a safe environment where you're going to be looked after.